I'm Mamela. I wanted to get on and just talk a little bit about chronic disease, right? In light of everything that's happening with COVID-19. Um, my journey with this whole thing started in 2014 when my mom was diagnosed with ovarian cancer. In 2014, I completely forgot that I am a researcher for a living. Didn't do anything, just kind of wanted to close our eyes and move forward with um, conventional treatment, which is okay. However, there are other additional steps that needed to happen to help my mom, go through the treatment and recover better in general. So, as it came back in 2016, I was moved to use my skills to help her along. And in doing so, I discovered all these other things. I discovered so many things about other chronic diseases and sort of that cancer was really the latest stop, right? So, come to find out, hypertension along the way, diabetes along the way, high blood cholesterol along the way, those kinds of things, those are all red flags, and our bodies are telling us, like, I'm not happy, something needs to change. And so I decided to look into COVID-19 as it relates to um, what's happening these days with chronic disease and how people with chronic disease are really affected severely by COVID-19 in comparison to those that are healthy individuals. So um, we can start by just looking at the numbers, right? Um, hey, there's no surprise, right? There's no surprise here. This has been everywhere. I don't really watch the news very often, but even I know uh, that Black people are the most affected, and there's reasons for that. So this slide talks about all the different states, New York being the highest, where the most Black people have been severely affected by COVID-19, followed by Michigan and then Connecticut, Louisiana, Washington, and Illinois. This is the reason. Health disparities um, are a huge part of this, right? Uh, so the idea that when I think about Chicago, it's really kind of set up in this way. Uh, that if you drive in Chicago on a particular street, say you're coming from north and you're going south, or you're coming from east and you're going west, you'll see neighborhoods change. And so, that being said, uh, minorities really live in the more densely populated areas. Uh, that's That's true. So it's much more difficult to distance to be to do the social distancing. Um, and I'll kind of share these slides sort of in a general sense because they can be read, but the health disparities really uh, account for really bad outcomes. Uh, the grocery stores, this is a big one because in neighborhoods that are predominantly filled with minorities, there are no grocery stores. There are corner stores, there are liquor stores, right? Um, but there are no grocery stores or really any grocery stores where people can go in and get some fresh fruits and vegetables, these whole foods that really sustain our bodies. So instead, people will eat white bread, chips, candy, stuff like that that have no real like nutritional value, versus eating things like kale, apples, bananas, those kinds of things that have a higher nutritional value. So in other words, it's like if you were driving a car and you're pouring water into the car instead of the gas that it needs, right? The high quality gas that it needs. And so our bodies react the same way in which the car would react, and they stop functioning properly, and disease shows up, right? It talks about the medical facilities, lack of insurance that, you know, Hispanic people have 3 times the likelihood that they won't have insurance, and Black people are twice as likely not to have health insurance. So it makes it difficult to receive care. There's also an overall lack of trust for the medical um, industry, unfortunately, because of history. Um, I'm just thinking about the Tuskegee trials in general. So, um, minorities are overrepresented in jails, right? True. And then there are these multi-generational households that are found primarily with minorities, and it makes it hard to socially distance. I mean, the example I have in here is, how do you avoid taking care of grandma when grandma needs help, right? Uh, Work circumstances are another factor, right? They're critical workers, and minorities overrepresent these critical workers, people that have jobs, in the grocery store, in places where they need to work during this time, or need to work based on, the economic situation, just needing to work to make money, right? Same thing with sick leave. So not having sick leave and having to work, uh, bringing in um, anything when sick, uh, if possible, if sick, I should say, if sick, bringing in, say, COVID-19 when sick, because it's better to go into the workplace than to stay at home, because if I stay at home, then, I'm not going to get paid. So, this time is not necessarily, it's not something new, right? Um, it's a repeating thing. Anytime there's a public health emergency, minorities are the most susceptible to severe consequences. So, my question is, when does it stop, right? So I looked at the CDC website, and the first thing that was recommended is to improve day-to-day life and harnessing the strengths of these groups through family, faith, cultural institutions, just looking to the community for support. Uh, the community should look to itself for support, in other words, right? So, what does that mean? It means that it's important to take responsibility and have accountability for actions taken within the community as well, right? So, one of the things that I learned through my journey is that once I start to take responsibility for my actions, I've noticed that outside help comes as well. Both are super important. But if outside help comes, right, if there's suddenly a grocery store down the street and I'm still going to the corner store, then I'm not helping myself. So, I'm aware that these grocery stores are really far, but it's important to start trying to make an effort of getting together, finding somebody that will go to those grocery stores, using delivery systems, that will help get those, whole foods to the house, things like that, to take care of the community. Because, unfortunately, it appears that this is just the beginning. This is round one. What's going to happen during round two, round three, round four, right? Is it a waiting game for somebody to come? No, right? It'll be great when somebody comes, but it's just really important to focus on what we can do for ourselves when going through a tough situation, and then also seeking outside help. Both are important, very important. Um, and so some of the things that the federal government is doing is that they're collecting data to monitor and track disparities. They support partnerships. They provide guidance on what to do to uh, to stop the spread, and they help public health professionals, right? But again, right, it comes back to this whole idea. While all of that stuff is happening, what are you going to do? What am I gonna do? Right? It's so important, you know. Um, the slide really talks about these chronic diseases that have been shown to really be the ones that cause the most issues. These are the diseases that have been tracked in light of COVID-19 and have been causing the highest level of mortality. They're not in any particular order, but they're high up there, all of them. So diabetes, which I'm going to talk about it more so in this particular presentation. Um, I'll talk about the other ones in a different presentation because it's just quite a bit of information. But uh, I'll talk about diabetes and then I'll talk about the rest later. So, people who are immunocompromised, right? People who have cardiovascular disease, kidney disease, lung disease, also are in high, in danger. So, it's important that, uh, we pay attention to these things. And this slide just kind of talks about the things that happen before the bigger things happen. But high levels of cholesterol, um, high blood pressure, right, and cigarette smoking. So back to what I was talking about in terms of disparities as well as these food deserts, right? This is just a map that kind of shows the food deserts in Chicago, right? It's very apparent that all of those places are mostly on the south side and on the west side of the city, right? And then even though those things are there, what I said earlier is that it's just so important to be able to change the narrative, right? It's a hard conversation to have, right? Just because my great grandmother, just because my grandmother, just because my mother ate a certain way, doesn't mean that I have to eat the same way, right? It doesn't mean that I have to believe that just because genetically, you know, people before me had high blood pressure, just because genetically people before me had high cholesterol, all of that kind of stuff, that I'm going to get those things as well. I can change my behavior and not get those things. And I'll talk about that in the study of epigenetics. That's really all it is, right? There are all these different things that I listed earlier in terms of disparities and, the lack of education, the poverty, the racism and discrimination, and I've switched over to eating more fruits and vegetables as well. And I can tell you that it's really not as expensive as one might think, right? There are different ways to get these things. Um, I'll definitely help with that as well with an additional video. Lack of resources, right? These are some things that are needed to support people. However, uh, they still can be done without a ton of support. The diet and smoking, right? Smoking that's got to stop, man. Like this has just been shown to cause all sorts of issues. It's time to stop. We got to start taking care of our bodies and the lack of access to healthcare. So I'm starting to get a little bit more into this diabetes deal. And so, uh, as you can see, right, it talks about all the different diets in this study. And really, it shows that people who are vegan are less likely to have diabetes. Those who are lacto-ovo-vegetarian have a little bit of a higher increase in that. So those are the people that eat milk and eggs, cheese, things like that, but no meat. People who eat fish, those people are a little bit higher. Those people who are half vegetarian, um, they also have a little bit of a higher increase, and then the numbers go up. People who are not vegetarian, those people's numbers are the highest. So there was a study that looked at um, COVID-19 and diabetes. Actually, quite a few of them here, but I'm going to highlight a couple. This one really just says, right, that people who are elderly, right, and people who have chronic disease, like these particular diseases that we've been talking about, if they get COVID-19, both of them have the same amount of um, possibility of mortality at the same rate, right? So, in other words, I could be 37 and there could be an 85-year-old, right? If I have a chronic disease, I have the same chances of dying as that 85-year-old. So another study shows, and this was a Chinese meta-analysis that looked at the most prevalent cardiovascular metabolic comorbidities with COVID-19. Same deal, right? Hypertension, cardio, cerebrovascular disease, that's a little different. And then here goes diabetes again, right? So, um, so here's another study, right? It talks about how diabetes is one of those significant predictors of severity and death, unfortunately, in patients affected with COVID-19. Um, and and it kind of goes back into history. Actually, it goes back into the 2009 H1N1, the SARS-CoV, and the MERS-CoV. So, as I mentioned earlier, history continues to repeat itself. Um, so, why all of this, right? And so it continues to just say future research is needed, more research is needed. It totally is. But in the meantime, what is there to do instead of waiting around and adding to the statistics, right? Um, I talked a little bit about genetics and epigenetics earlier. This is really important. Um, so genetics, right? Uh, Things that are inherited from our parents, their parents. Um, but when we get into epigenetics, we start talking about sort of other factors, so the influence on those genes, right? Um, So we inherit as well some of the things that our parents did. Uh, so so I can think of a particular study. It was a mouse study where they injured the brains of the mice, right, to induce trauma. Right? So there was a generation of mice who got traumatic brain injury, and they displayed these behaviors that were associated with that, right? So some isolation, not wanting to play in rich environments, things like that. They sacrificed those mice. Those mice then had their own, sorry, before they sacrificed the mice had their own offspring. And then they sacrificed those mice. And then their offspring exhibited the same behaviors as their parents, right? And they didn't do anything to those mice. Those mice then had offspring. They sacrificed that middle generation, and the mice that were born after that also displayed those kinds of characteristics, right? And I can't remember, so the numbers kind of trickle down, but in general, it kind of shows just kind of how our parents' uh, behaviors also affect us. The most important thing these days that's been looked at is sort of what we do in our current situation, right? What kind of environmental exposures and what kinds of things are we doing for ourselves, right? So if I'm born with a gene that, you know, most of my family has hypertension, and it really doesn't mean that I have to have hypertension. I could change the things that I do, right? So that I don't get hypertension. So I like this model here because it really gets into it, right? You have twins. Let's just say, right? You have twins. One twin eats burgers and beers all the time. Burgers and beers all the time, right? What's gonna happen to that guy, right? He's gonna be obese and he's gonna have a disease phenotype, right? That's just the way that his genes are gonna express themselves. He's gonna have disease. Another guy, he eats safely, this Mediterranean diet. He's going to have a lean phenotype and a normal phenotype, right? So that just means that he's not going to have disease. He's less likely to get disease than the guy who's eating poorly. So, it's not just diet, it's environment as well. It's pollution, stress, um, it's not moving, not exercising. All of those things play a factor in how our genes express themselves. So that's just really important as I continue to talk about this idea of taking the first step to change, right? If I don't change, nobody is going to do it for me, right? If I don't take the extra effort to take care of myself, nobody's going to do it for me. So it's just really important to remember that, right? Take, don't, to take away this, this mentality that it has to be a certain way or that it just is what it is. It's not just what it is, right? There are many things that could happen, behaviors that could change. Some may take more effort than others, but it's important, right? So that we don't wind up being a part of the statistic as well. So I looked at some recommendations from the American Diabetes Association, and they recommended whole, unprocessed, non-starchy foods for people with diabetes. Lots of green leafies, listed them there. Some cucumbers, broccoli, tomatoes, green beans. So all of these things, as you can tell, are things that come from the earth. Um, I've had a rough time with kind of admitting that there are some people that can continue to eat meat, just because but I've done some research and it just seems that the best way to go, especially when someone is struggling with chronic disease, is to have a vegetarian diet. There's some studies that really show that our bodies do certain things to really process meat as we put the meat through our bodies. However, as I look back um, at history and sort of the way that our ancestors lived, some of them did eat meat, but very sparingly, right? And it also depends on where um, our ancestors were, right? So if, say, our ancestors were close to the equator, most of them ate fruits and vegetables because the land was rich and it had all of that stuff there. So, but if your ancestors are from the North Pole, chances are that they ate more meat than the people that were around the equator. So these kinds of things are conversations to have with someone who might be a functional medicine doctor, who might be able to order more tests to look at sort of specific genes to certain people and then decide, which way to go with diet. But that being said, whole foods are just things that are not packaged. Stay away from packaged food, things that are man-made, right? Um, so if we're talking about mostly fruits and vegetables, fantastic. Not organic, meat sparingly, okay. But these are things that could be tweaked based on where people are from and how they feel when they eat them. So those are just additional conversations to have. But packaged food is just, it's not food. It's not good for you, right? Um, Processed packaged food. Here's some other examples of things that they recommend. Again, whole foods, again, minimally processed. Um, carbohydrate foods. So they talk about the fruits and the vegetables. Sorry, the fruit, the apples, all these different kinds of fruit. Especially with diabetes, it's important to look at what's called a glycemic index. You can just Google it, right? Low glycemic fruit, glycemic index fruit, and things will show up, right? So there's some things like pineapples that are high on the glycemic index, which kind of increase blood sugar really quickly. So it's important to not have so many of those, but berries are really good um, because they also have fiber, so they kind of digest a little bit slower and don't increase blood sugar so fast, right? And then it talks about some other starchy vegetables, some beans and lentils, which are really good for protein. Um, and then nuts and seeds, really, seeds are usually smoothie, but they also have a lot of protein and other things as well. Yeah, so if you're going to get into these minimally processed foods, they talk about the grains, uh, intact grains like brown rice, the whole wheat bread, whole grain pasta, and oatmeal, but less of these. So the ADA also says eat less of these things: sugary drinks, refined grains, sweet drinks, cookies, chips, all that stuff. But honestly, um, it's important to stay away from these things, especially when someone has diabetes. They just are not going to do any good. So it's really important to stay away from these foods. I want to talk a little bit about this. This is one of my favorites. Uh, Dr. Fuhrman, his food pyramid, as you can see, is kind of really reversed for the most part. Uh, he talks about having 90% of the daily diet coming from whole plant foods, right? Um, and so, as you can see, the majority of it is vegetables. You have beans and legumes, fruit, nuts, seeds, avocados, whole grains, potatoes, right? And it gets small, like the pyramid gets, should be having less of these things as I'm talking. He has the poultry, the oil, the fish, and the dairy, and then he has beef and the sweets and cheese and all that stuff at the top. But if you're eating 90% from fruits and vegetables, whole plant foods, and nuts and seeds, things like that, it's going to be good, right? So he talks about this concept of um, um, nutrient density, and and then he comes up with this equation, right? Health equals nutrients over calories. Love it, love it. So basically, all that means, right, is if you look at this chart here, it starts off with kale. Kale has 1,000 nutrients per calorie. That's awesome, right? That's why everyone's always talking about how good kale is, right? And then you see all the green leafies are up there. They have spinach, bok choy, romaine, all of that stuff. Like it just is high on the nutrient density scale. So it means like for 1 calorie, kale has 1,000 nutrients. That's awesome, right? So then it goes down, right? And then so let's look at uh, whole milk. Whole milk only has 25 nutrients per calorie, eggs 27, chicken 31, right? So in order for us to put the good oil in our tanks, the good gas in our tanks, right? In order for our bodies to function properly and optimally, it's important that we get these foods that have high nutrient um, density counts. So, yeah, I mean, I read quite a bit and I kind of simplified some things. So, those are some of the references. But next time I will talk about, I'll probably talk a little bit more about nutrition. And, there's been a lot about fasting as well. Uh, and not just diabetes, I'll talk about other chronic diseases. I'll continue to go down that path. I also want to touch on stress, how important it is to take care of stress, um, and then exercise, right? I'll post this. The link here is from the American Diabetes Association as to kind of how to start exercise. Um, all of that stuff is important to fight chronic disease. So, we'll continue this conversation. It's important that when round two, round three, round four hits, we are prepared. I personally am having a hard time seeing uh, the bad news, the sad news about people losing their lives due to having chronic disease and then COVID-19 hitting and all the other stories associated. But this video is not necessarily to induce fear, right? This video hopefully will produce hope because, again, something can be done, right? Something can be done. We can take control of our lives. We can control what we put in our mouths. We can control what we do every day when we get up in the morning, in the middle of the day, whenever, like get some exercise, right? We can do some things to reduce stress. So it's just really important to get into that mindset to know that some of this stuff is in our hands and we can change our behaviors. So I hope this was useful. Listen to it a couple of times if you need to. Let me know how I can help. and I'd be happy to do so. All right.